Napoli. My name is Christopher Napolis. My clinical question of interest is how can we mitigate the rates of inpatient falls in the hospital setting? The contributing factors are nurse education, patient adherence, and understaffed hospitals as can be seen on the concept map. The clinical question is important because common adverse, particularly in the hospital setting. I learned that contributing factors to patient falls are patient physiological hindrances, environmental hazards, light, carpets, rugs, and not wearing slip-resistant socks or footwear. Evidence-based strategies to address the clinical question would be improved staffing, education on fall prevention interventions and techniques, and implementation of a culture of safety. A study conducted by Cudney Lee et al. In 2020 found that improved nursing staffing is associated with a lower incidence of patients in hospitals. Specifically, the study for each additional patient per nurse, the odds of a patient falling increased by 6%. Furthermore, the study found that having a higher proportion of registered nurses on the staff was associated with lower incidence of patient falls. Multi-component fall prevention interventions that include patient education, staff training, and the use of assistive devices have been shown to be effective in reducing the rates of patient falls in the hospital setting. Patient education should focus on fall risk factors and strategies for preventing falls, while staff training should emphasize safe transfer and ambulation of patients and techniques, the proper use of assistive devices, and proper patient handling. Per Haynes et al. 2019. Studies have shown that hospitals that have implemented a culture of safety have lower fall rates than those without such a culture. For example, a study by Rohrer 2019 colleagues found that a culture of safety was associated with a lower rate of patient falls in a pediatric hospital. Furthermore, a culture of safety can facilitate the implementation of other fall prevention strategies such as staff education and training, environmental modifications, and fall risk assessments. The theory that I chose and how it's appropriate to the clinical question is that the nursing theory is a holistic systems approach nursing care to nursing care that views patients as dynamic, interconnected. The theory considers the physiological, psychological, and environmental factors that influence a patient's health and well-being, per Newman 2015. Moreover, the Newman system model emphasizes the environment and safety, which includes factors such as staffing, patient care equipment, and design. In addressing the clinical question of how to manage inpatient fall rates in the hospital setting, Newman's theory was appropriate to use because it emphasizes the importance of considering multiple factors that contribute to falls, such as physiological, psychological, and environmental factors. The model also recognizes the nursing process, which involves diagnosis, planning, implementation, and evaluation of nursing interventions to promote patient safety and prevent falls. Moreover, the Newman system model emphasizes the importance of the environment and patient safety, which includes factors such as patient care equipment and environmental design. The clinical question and the selected theory link in that Newman's model emphasizes the importance of a patient as a whole system, which includes physiological, psychological, and environmental factors that impact health and well-being. This is particularly relevant in the case of inpatient falls, which can have multiple contributing factors that may include physical and cognitive, medication side effects, and environmental hazards. My final theory conceptual map. So whether you implement the secondary prevention at any level, you outcome of reduced rate of inpatient fall. After identifying risk factors, which is primary prevention, if you implement secondary prevention, you get the ultimate outcome of reduced rate of inpatient falls. Secondary prevention, you get directly reduced rate of inpatient falls in hospitals. Once you implement secondary prevention and move on to tertiary prevention, we reconstitute and still end up with the reduced rate of inpatient falls in the hospital. So, the nursing process, which is a key component of the Newman system model, provides a framework for assessing and addressing patient safety risks, including fall risk. For example, healthcare providers can conduct fall risk assessments, implement bed alarms, or use low beds and provide education on fall prevention to patients and families. So my aha moment was when I realized that improved staffing and education were applied, if applied at a level of intervention, will ultimately lead to an outcome of reduction in the rate of falls. And the final ask is takeaway that I want my peers to take from this presentation in their as nurses or practitioners, that they can address safety risk factors for inpatient falls and greatly reduce the rate of inpatient falls in the hospital setting, clinical setting, in the healthcare setting that they may be working in. And implementing a culture of safety is of great importance in reporting falls and taking steps toward mitigating the rates of patient falls. And thank you for watching. That's my presentation.